also the transportation of the glucose into the cell. So oftentimes with type 2 diabetes, it's not that you're low on insulin for the transportation, but once it gets to the cell, it doesn't actually able to get into the cell.
Okay.
And that's where aerobic exercise and the ECP with a resistance, what they call an insulin resistance type of type 2 diabetes, it's absolutely amazing the changes that occur, and that is the majority of type 2 diabetes. Type 1 is with the lack of insulin, which this doesn't do anything for. But for those who are actually suffering from the type 2 diabetes,
which is lifestyle.
Exercise, that's why they always recommend exercise for that. This actually has dramatic changes, and we've seen a huge reduction in people who've had problems along those lines to actually get to the point that they have their type 2 diabetes under control. So ECP is also excellent for that.
What about for the ECP, improve athletic performance?
Oh, very good point. One of the things is I have some coaches who are long-distance coaches for cross-country and track. And in Runner's World and several different research papers that they've done, ECP has actually become an integral part of the distance types of athletic events. So one of the things that has occurred is there has been a huge amount of breaking old established records lately. And the American Olympic Committee has actually put the external counterpulsation on their training table.
Wow.
So that they have been able to, even people who are marathon runners, have found an incredible amount of improvement in their performance by adding ECP into their program. And you wouldn't think that, that anybody who's actually doing that much aerobic exercise, that they wouldn't need the ECP.
Right.
But the improvement was actually very dramatic, has been well documented, and has actually become a part of the training regimen in almost all high-level endurance athletics. Now, the other thing is that I have it, which is actually kept kind of quiet, but I have it in good circles, that many of these long-lived athletic people who, you wouldn't think that they would be still playing basketball in their 30s, heading into their 40s, or playing football, or performing at the level that they are on a continual basis.
Some Olympians, yeah.
But the ECP, if you are, one of our 8 pillars of perfect health is aerobic exercise. Oxygenation. If you go back and listen to our radio shows, and we did a whole series on the 8 pillars of perfect health.
Right.
And the number 2 on that was oxygenation. And one of the things I say in there is if you were perfectly oxygenated, you would look like you're 21 the rest of your life. That's absolutely true. If you are perfectly oxygenated, actually your cells think they're 21 the rest of your life. So this is a oxygenation machine. It improves the oxygenation to the cells better than any other treatment that I know of. And if you want to stop aging, getting that oxygenation up to the level it should be, and the ECP has a huge benefit along those lines.
Well, with all the benefits, why don't we see it done more often?
I knew of ECP, had read about it, was very excited, had actually located, who had ECP here in Indianapolis because I wanted to refer some patients. And so I called up the particular cardiologist, and actually one of them I knew, and I had a patient who had congestive heart failure, knew that he needed that to be able to survive, and called up a cardiologist friend and said, you have ECP, I'm sending you a patient. And they came in, did all the checks on him, and said that they weren't going to do the ECP, and I was upset with him, called him back and said, why? I mean, this would be a huge benefit to him. And he told me that the rules that he has to work under was that he could only do the ECP as if everything else had already been tried and had failed. There were certain criteria that he could actually use it. And I said, this is ridiculous. Mm-hmm. This is something that has been proven to be of benefit. This would be much less invasive than the other things that you're talking about. I don't understand. And he said, look, let's just be honest. I am a disease doctor. Mm-hmm. And as a disease doctor, I treat in a certain type of a way. ECP is a functional medicine. Mm-hmm. It's functional medicine. It's just an aerobic exercise machine. That's what it is. And I don't do functional medicine. I'm a cardiologist. I deal on a certain type of a level where I am dealing with disease. And functional medicine is not a part of my repertoire. Mm-hmm. You're a functional medicine doctor. You get it. You do it.
And that's what you did.
And that's what I did.
Mm-hmm.
And
unfortunately, not in time for the one gentleman.
For the one gentleman, we did not have it set up, and he did die, which was something that was very upsetting to me. And I promised myself I wouldn't lose another patient along those lines again. Mm-hmm. So we bit the bullet, spent the money on the ECP, got it into our system, and if we've been able to save many, many lives with that, and keep people from getting to that point.
Now, the ECP is very popular in other areas of the world, like China and Japan. Why there? What?
The doctors in Japan and China aren't limited. The healthcare system there incorporates functional medicine as a part of their integrated system. Mm-hmm. So there isn't the separation, and there is a willingness to actually use functional medicine as a primary type of tool. So, as a matter of fact, in China and Japan, the first line of defense against cardiovascular disease is ECP. So, actually, as people get older, if you get people in their 60s and 70s, people who can afford it, have the insurance, almost every man has had, man and woman has had ECP therapy.
Wow.
It's something that's actually prescribed on a regular basis. It is the number one cardiovascular treatment over drugs and surgery in China and Japan. Mm. And it has really very dramatically reduced the incidence of cardiovascular attacks, because that was a huge problem, because, quite frankly, they smoke like chimneys over there and don't see anything wrong with it. Mm-hmm. So their lifestyle is actually worse than the Americans. So ECP is something that you actually expect to do. And if you can afford it, then everybody actually does it. Mm-hmm. So it is the number one treatment over there, and they have found a huge reduction in the cardiovascular incidence. We, on the other hand, with our drugs and surgery, have been able to make absolutely no dent in our cardiovascular disease rate. Whereas, as they have implemented the ECP over there, they have seen a dramatic fall in their cardiovascular disease. So, the whole thing actually proves itself. And, we talk about trying to fix our healthcare system, and we have the whole changes that have occurred. Mm-hmm. But, you can't break something that is just designed wrong.
Mm-hmm. At its core.
At its very core. Mm-hmm. We have to actually bring functional medicine into our healthcare system if we are actually going to make the changes, because disease care is the most expensive, ineffective, and frustrating system to actually get people well, because it's not designed to. It's designed to treat symptoms, not actually get people healthier.
Mm. Very good. Well, up next, we're going to talk about the actual treatment, what people can expect from the treatment regime for the ECP. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of Meridian Health and Wellness. Dr. Prather, what is ECP therapy?
ECP stands for External CounterPulsation Therapy. And just to put it into a nutshell, ECP is an aerobic exercise machine. Now, you sit there and say, well, why do you need an aerobic exercise machine? It is the number one treatment for cardiovascular disease. If you look at the research and want to find out, well, how do I fix my cardiovascular disease, whatever it might be, always within the scientific literature, aerobic exercise is one of the most proven, most effective means of reversing cardiovascular disease. So, but the problem is I have people who I sit there and I look at them and I say, well, what do I do about this problem that I have, Doc? And I said, well, go out and run 5 miles, every day. And of course they all laugh because it took every effort that they had from going to the waiting room into the exam room,
Right.
And they're out of breath. So that didn't work. So what was actually done was develop a machine that actually simulates the effects on the body of aerobic exercise, and that's where ECP comes in. And what occurs with ECP is that there's actually a second heart kind of put into the body. Mm-hmm. It's on the outside, but as the heart goes into relaxation, that's when it actually gets its blood. So what we do is we actually have blood pressure cuffs around the legs. It presses on the legs, and we get a huge amount of blood that goes back up to the heart. And the heart is very regenerative, and you get about 10 times as much oxygen with this particular type of treatment than what you normally would. And you get a regeneration of the heart. You also get a cleaning out of the arteries, and you actually get a huge amount of changes in the whole physiology of the body. So all the benefits of aerobic exercise are actually found in ECP, which are absolutely the number one way that you can be able to reverse cardiovascular disease, diabetes, and many other problems.
Meridian Health and Wellness is currently accepting new patients for ECP therapy. To find out if ECP therapy is right for you, call our office at 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. Hi, I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather. We're talking today about ECP, putting the pulse back in your life. And Dr. Prather, we're talking about other countries using that as their, Japan and China. ECP is very prevalent. And the benefits it's helped them as a country and their health. Are there any risks with ECP treatment?
One of the nice things about the ECP is there has, because you actually have to keep track of any injuries that occur with the federal government, and there has never been an injury with ECP in its over 40 years of utilization, which is a very unusual type of a picture along those lines. There are certain things that we screen people for. There is, if there's inflammation in the veins in the legs, then that would be one thing that would preclude them. There can be some certain valvular problems up in the heart. The aortic valve, if that's diseased, then that would be something that would actually keep us from doing the ECP. but there aren't really too many